Dr. Nathan Martha. My journey with Prof. Bakar started not a while ago. I was diagnosed to have uterine fibroids, and getting in contact with a few colleagues of mine, a very close friend of mine as well, who's a doctor. She referred me to Prof. Bakar after attending one of the conferences that were discussing about laparoscopy. Well, I went in, we scheduled a meeting after calling him. He was kind enough to actually schedule a meeting over the weekend, given our schedules are a bit complex as medics. He went through my previous history, and he requested for a few more tests to be done, which were done within the shortest period of time. And within 2 days, a week, we had scheduled the operation, that is the myomectomy. And I had concerns about the approach that he would use, because I went in knowing that he's a specialist, one of the best specialists known for laparoscopic surgery. And he went, he took us through, myself and my husband, took us through the procedure and how he would approach it, given that we had seen a few other specialists that had recommended that the procedure would be an open surgery. So this was, we were seeking for a second opinion, and we got Prof who took us through the procedure. And within 2 weeks, we were scheduled in for the procedure. It was a smooth transition, I must say that, because from the insurance, the claim forms, pre-op preparations, everything went on smoothly. So far, this is week 8 post the operation. I must say it was a very smooth operation. It took a day. We were in very early in the morning. Operation started at around maybe 8 to 9. And by evening, I was home, which would have been a different story if it was an open procedure, because that meant or means that you have to sleep in the hospital and be discharged maybe 3 days after. But this was a day procedure. I got in the morning, the operation was done. And keeping in mind, I had 2 procedures in one sitting, that is a laparoscopic surgery and a hysteroscopy. And I was home by 8 p.m. And he had promised, I asked him how long would it take for my recovery, for me to have at least full recovery, given that I needed to return to work. He'd say that at least within 10 days, and true to his word, within 2 weeks, I was back to work. Pain was manageable. I was able to walk around, do a few, things here and there. Of course, you have to be careful not to do heavy duty work like housework. But there were no post-op complications. They called me in the day after the operation to check on me, which I found to be very good. And as far as today, I'm back to work the usual me and doing house duties, and no complications at all. Oh yes, I would, without a doubt. I mean, because as ladies, I think, ladies out there, women, they may not be able to, they are not given those many options, because there's an option for laparoscopic surgery instead of an open operation, which will give you less time in hospital, so meaning you're having less complications, post-op complications. And the scar is quite so small, because if it was an open surgery, given the position of the fibroids, because if it's at the back of the uterus, it may be hard to approach. but he was able to approach my fibroids because some of them were at the back of the uterus. The scar, if it was an open surgery, the scar would have been, if anyone has had a cesarean section, that's how large it would have been. But the scars are very tiny. Okay, being sensitive as a lady, your body is going to change. You have a scar. The scars are almost like 2 centimeters or less. Yeah, which is and they're very, very beautiful. They are healing very well. I would, without any doubt, recommend him. He's very kind and passionate. Okay, and yeah, he's actually a champion. Yeah. In this field, since he's the one who introduced this procedure to Kenya.